You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in dentistry? My first guests are father and son dentists. If you are afraid of the dentist or haven't been in a while, or even if you're looking for a great dentist, you got to meet these guys. My advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in dentistry? With us, we have the founders of Briggs Family Dentistry, father and son dentists, Dr. Roger and Dr. Brad. Doctors, welcome to the program.
Thank you, Randy. Pleasure to be here with you.
Dr. Briggs, we'll start with you. I guess in your practice, father and son, they call you Dr. Roger and Dr. Brad. Is that right?
That's right. And some people refer to us as the tall one and the short one.
Okay.
But it's never allowed to refer to us as the old one and the young one.
Okay, now before we get into today's topic, I guess Briggs Family Dentistry has been around a long time. How long have you guys been around?
Well, I started there in 1973 at Shea and Scottsdale Road. There's one other guy that's been there just a little bit shorter than me, but I'm the old guy at the corner now.
Okay. Now, you said to me on the phone when we met, you said, we're real family dentistry. I mean, you've got, tell me about that.
We are. Brad's, he started in the practice when he finished dental school 3 years ago. My daughter just finished dental hygiene school, so she's one of our dental hygienists. My wife has worked for me since I graduated. She was my entire staff. She was the front office, she was my chair side, she sterilized, she did everything.
Is that right? Dr. Brad, let me ask you, now how long have you worked in the practice? A couple of years now, 3 years?
Going on my third year. This is my third
now,
year.
Did you always want to be a dentist? I mean, whose idea was it that he was going to be a dentist?
Well, actually, I started school as an art major, and after a couple of years of taking art classes, I decided that dentistry is art, and so I focused on sciences and ended up going to dental school.
Did you work within the practice part-time growing up?
I did. I started out filing charts and cleaning up rooms and sterilizing instruments when I was in high school, and I've worked as an assistant as well.
Now, within the practice, do you both do the same thing?
Yes.
I mean, does he specialize in one thing and you do another thing?
You know, there's things that Brad likes to do and things that I like to do. So we focus on those things, but in general, yeah, we both are, we're general care
Some of the
dentists.
newer things that are out, there's the CERAC dentistry where we use computers, and I enjoy working with
What
the
is that,
computers.
CERAC?
That is designing crowns in one visit, so we can...
That's the cap that goes on top of the tooth, is that right?
Correct, yeah.
Okay.
So we'll scan a tooth into a computer and I can design it there on the screen, and we design that crown, mill it in the other room out of porcelain, and we can put that in about 10 minutes after we've prepared the tooth.
So, you know, I hear expressions, things like tooth in a day. Is that what we're talking about here?
Exactly, yeah.
Where they go in. So how are they doing it in the old days, or how is it commonly done? It's sent out somewhere?
Well, I can tell you about the old days.
Okay.
Yeah, that was preparing the tooth, taking an impression of it, sending that impression to the laboratory.
Okay.
Now, while that's off at the laboratory, we made a little plastic temporary crown. In fact, way back in the olden days, we used a little aluminum shell to cover that tooth and protect it while we were waiting for the laboratory, which took anywhere from 1 to 3 weeks to fabricate
There
that
still
crown.
are times that we use the lab. There's real specific cases that we use that computer to design restorations for teeth, and the labs do an amazing job with some of our aesthetic work that we send out, and they do that.
Okay, so now with this, and we're talking about what's new in general dentistry or dentistry today. So this CERAC machine, is that correct?
Yeah.
It makes the crown with a computer image, fits on their tooth, and that's it. Less trips to the dentist?
Yes, that can
Obviously.
be done in 1 instead of 2.
Okay.
You know what else is new? Is using the CERAC with the lab technician. So the way the CERAC works, instead of filling their mouth with impression material, we have the special 3D camera that we take a picture of the tooth.
Okay.
I can now send that via email to the laboratory. He makes that at the laboratory and does some special staining or some special things to it that need to be done over and above what we might do in just the dental office.
Okay.
But we can have it back that afternoon.
All right. Now, Dr. Brad, I'll ask you. You're certified or licensed, I guess, to put people to sleep.
Yeah, we...
Is that something people want now?
Yeah, we do sedation dentistry, and we don't necessarily put people fully to sleep or to where they're unconscious. It's a really safe way.
Is it an IV?
No IV. We do that through oral medications. So
Okay.
it's just a simple pill that somebody takes the night before, and then we give them another pill the morning of,
Really?
and give them a couple doses until they feel really comfortable with what's going on, and actually no work begins until...
But isn't that what I mean, don't all dentists do that? I mean, how new is
No.
that? Because it seems like putting people out.
You actually have to have a permit for that. So I took the classes and now have my sedation permit, and it's going wonderfully. I can't believe how comfortable people are in the office.
You know, Randy, just last week, I had a guy who was so terrified, and I promised him we would take good care of him. It was so cool because he's verbally responsive. He can lay there, and I can say, turn your head to the left, or turn it to the right, or can you open a little wider? And he can do all those things. And he can get up, he can go to the restroom if he needs to, comes back, lays down comfortably. He called the next day and said he had the most incredible dental experience, and he said everything I said about feeling safe and comfortable and having a good experience, he said was true.
I'm surprised people are still afraid of the dentist. Like I told you, I mean, I've had pretty good luck with my teeth.
Yeah,
But you say some people are really afraid. I mean, this is a big thing.
yeah. You've got great teeth, Randy.
Well, thank you.
I mean, myself, when I was 5 years old, as a little kid there in Montana, they put me in a Deaconess hospital, pulled half of my baby teeth that were rotten, took my tonsils out, and I can promise you there was no chance I was ever going to be around a dentist again the rest of my life.
Okay.
When I moved to Montana, my best friend's dad was a dentist, and I had a big black hole right there in the middle of my two front teeth, and one day he said to me, Raj, why don't you come over and let me fix that for you? And he changed my life. He changed
Really?
my life, and that's why I'm a dentist.
No more
today.
fear of a dentist.
No more fear.
So that's really what inspired you to become a dentist.
Absolutely.
Just that great
Oh,
experience.
he was one of my heroes. He was a World War II pilot that was decorated. I got my pilot's license. I mean, I became a dentist, and everything about him was just amazing.
Are there a lot of people, by the way, that don't have a dentist? That means that, you know, they, like some people get their hair cut at 5 different places. I've had the same person for years. Is that the way it is in dentistry sometimes, where they're trying to find a home? Or
You know, I can't tell you how many times people will come in and with their first visit, meeting my staff, which, by the way, Randy, that's absolutely the most important part of my practice. We can talk about technology, we can talk about Cyrax and all these other things. My staff is the key.
Now, what if I told you that everybody says they have a friendly staff when they come on my show?
Uh,
Not lip service in your case?
and, well, yeah, I mean, that's one of those things.
We'll give that the cola challenge.
Okay.
Yeah.
Okay.
We really have amazing people.
So
that
they're
work with
friendly
us.
people.
Oh,
Because nobody likes
Well,
going to
not-
the dentist.
Not just friendly. They will go out of their way to help people with every aspect of their appointment. From, you know, we've had staff that will go and pick somebody up to get to their appointment, and helping them with all of the web of insurance, trying to get all those things filed for them. Our staff just goes out of their way day in and day out to help people.
So in your practice, by the way, what type of patients are you seeing? Because you're doing fillings and all the general stuff, is that right?
Right.
So who's your typical
We're in general
patient?
practice. Well, if it's a 5-year-old, it's going to be a child who's not afraid. I mean, he's going to be management problems. Both Brad and I feel it's so important for them to get a good start that we have pediatric specialists that treat these kids as a 5-year-old needs to be treated who's afraid.
Okay.
And so,
But some of the younger kids that we see with some of the newer technology again, we have lasers in the office, so oftentimes I can do small fillings without any shots, and kids are coming in and having such a great
So
experience
putting in
from the
fillings
beginning.
with lasers?
Yeah, we actually have a hard tissue laser. It's called a water lase, and it uses water energy to cut the tooth. And so no shots, no drills, no vibration.
no heat.
No heat,
No heat.
and kids have a great experience most of the time.
So that's something new.
Oh, that's the coolest thing. I mean, even with those little kids, you remember those big stainless steel 3-foot needles that we used to scare the wits out of
Yeah.
people with?
Okay.
Well, we have a thing called a wand now. It's computer driven. And people ask all the time, now, was there a needle on the end of that? And there is. It's the size of an acupuncture needle.
Okay.
So that can give anesthetic smoothly. The anesthetic that we use in it, it's not Novocaine, it's not lidocaine. There's a new anesthetic now called Septocaine that is so much more predictable. Comes on quickly, goes away quickly, and when it's there, it really works.
So people don't have to be afraid to go to the dentist nowadays.
So that's a typical 5-year-old. Then at the other end of it, we just did dentures for a guy in his 90s.
Okay.
And
A 90-year-old with
90
dentures.
plus. I won't
Wait.
tell you, closer to 100.
Yeah, really close to 100
How close?
this year.
Real close.
He's going to be a 99-year-old guy goes
Right.
in for dentures.
And he wanted dentures, and some of the things he told us, he doesn't date chicks that are over 70.
Is that right? Okay.
And then everywhere.
Does he
in
lie
between.
about his age?
No, it's a fact.
No, I mean, does he tell them that he's younger than
Oh
him?
yeah, he said.
That's
yeah,
patient confidentiality.
and he can pull it off. I mean, he looks great.
Okay. So you do make dentures. Have dentures come a long way? Because I always feel like I could spot dentures.
There's still a lot of people that wear dentures. Oftentimes they're not aware, and Scottsdale's kind of a retirement area. The whole Phoenix Valley is a retirement area. So some of those people who haven't been to a dentist in a long time aren't aware. They need to have their mouth checked and see how the denture fits almost as often as somebody who's got their natural teeth that just needs to come in and have hygiene visits.
That's true. As people are moving to Arizona, Phoenix is growing, and I'm sure there's lots of people out there who need to find a dentist, and we'd love to see people who would like to have their denture looked at or repaired. Or
Is a denture, are dentures just like any other part of dentistry and health? We wait till it literally breaks before we fix it.
Many
When do
times.
they put it off?
Many times. I finished up a case this week of a lady who she came from one of the Eastern Bloc, one of the Russian countries. Family in Phoenix said, "You got to get out of there. Come over here." She needed to have her teeth removed. They were too badly diseased, and she was terrified. Apparently, the anesthetic's not readily available in Russia. We had all of her teeth removed, and we made her a set of dentures. She nearly cried. She had pictures of all the staff with her,
Is that
standing
right?
in the middle, smiling, because she wanted to show everybody back in Russia who did this thing for her and gave her some beautiful teeth.
Okay. Now, we're talking about, again, what's new if you're just tuning in dentistry today. A lot of talk about metal-free dentistry. Some people are afraid of amalgam fillings or whatever. You guys are doing this as well?
I haven't put an amalgam in a tooth except in a mission field for probably 20 years.
Okay.
The
So that doesn't even happen anymore?
No, it does.
Oh, it does?
It
Okay.
does. And I would tell you this too, that amalgam is a very fine material. Now, in the scheme of things, that's what I use in the mission field, because it's quick and we don't have to have all the equipment to install it, and we can do it right there on the spot without curing lights and the technique sensitiveness that these white fillings are. They're very technique sensitive.
Okay.
So, that being said, there's nothing wrong with amalgam except the color of it in most people's minds.
So it's easier, though, for the dentist
Oh,
to put it
it's
in.
way easier.
So you guys put what in? I mean, what is it, the material?
So, if we don't have amalgam, then the other things that we use in dentistry, the white fillings, are made of a composite resin. And then another level beyond that is porcelain and gold.
Gold. Yeah. Now, we talked on the phone, and you said you put gold in the mouth, and I thought that's like old school dentistry. But
Well,
it's good.
It is old school. I mean, they got stuff in the pharaohs. They found some of those mummies with gold in their teeth. So it's been around a long time.
Right. So why use gold then?
I actually have a great reason why we use gold. I've been up to Seattle, Washington for some training in special techniques and how to do conservative gold, where we save a lot of the tooth. And the instructor up there, I saw pictures of some of his gold work that has been in the mouth 60 years and looks like it was done yesterday. And there's nothing out there that is as durable.
So it's durable.
Oh, that's the whole thing.
But is it a lot more expensive?
No.
Really?
The fees are almost the same as porcelain.
Brad, let me ask you, we talk about what's new in dentistry. What haven't we talked about? Now, as far as whitening, has that come a long way?
Whitening has come a long way, and I've been practicing for 3 years now. But as we went through school and learned about it, they used to heat teeth up and try all sorts of different ways to get them whiter. Some of the newest systems out there, the Zoom system, in 45 minutes we're whitening teeth. People are leaving really happy, not as sensitive. So the whitening process has changed.
Well, I can tell you that's changed. I'm telling you, 20 years ago or whenever that stuff first started, we used to have them wear that stuff all night long, and it tasted horrible.
Yeah.
Their teeth were sensitive, but people really wanted to have white teeth. They were willing to do that. Don't have to do that
What
anymore.
about Invisalign, things like that? Are you doing that in the office?
We're doing the Invisalign too. Once again, we work with specialists. Some of the top Invisalign orthodontists are right there in Arizona.